in. Hi, I'm Jordan. I'm going to be your nurse today. I'm going to be performing a respiratory evaluation on you for your thoracic cavity in your lungs. Let me just wash my hands before we get started. How are you doing today?
Good, how are you?
Good. And I'm going to verify your name and date of birth.
Millie Brown, 2/18/2004.
Okay, perfect. Okay. I have a few questions for you. Have you ever experienced any wheezing while doing physical activity?
Mm-hmm.
Have you ever been diagnosed with asthma?
Mm-hmm.
Okay. Well, I'm going to go ahead and get started. First, I'm going to inspect the thoracic cavity, and it is, I'm noting the shape and configuration. It is symmetrical with an elliptical shape and has a downward sloping rib of 45 degrees on the front and the back. And I'm also noting that the AP diameter is a 1:2 ratio, and I am noting that the neck and trapezius muscle are appropriate for her age. And I'm also assessing the ability of breathing, and there's no accessory muscles being used. I'm also noting that there is symmetrical chest rise and fall while breathing. Next, I'm going to assess your pulse. If I could please see your wrist. Thank you. Okay. Respiratory rate is 14 and regular. I'm also noting the color of the patient's skin, if I could please see your nails. I do not see any pallor around the nails or the lips, or any signs of cyanosis around the mouth or the lips. Next, if I could please get you to swing your legs off to the side, please. Thank you. And if you could please take a deep breath for me. Perfect, and you can swing back around. I noted that my hands equally rose and fall, but if I did not have this happen, it would indicate that there is a potential for atecolasis, pneumonia, thoracic trauma, or pneumothorax. There was also no pleural friction. Okay, now I'm just going to check for any lumps and tenderness. If you feel any tenderness, please let me know. Is this hurting?
Mm-hmm.
Okay. Any tenderness through here?
Mm-hmm.
Okay. Perfect. And then I'm also checking to see if there were any lumps, and there were no lumps present. I'm going to check for the tracheal positioning, and it is straight and in the midline. And now, if I could please get you to take a deep breath for me. And patient is able to breathe through their mouth. Next, I'm going to be assessing your pleural, anterior, and lateral breath sounds, and I'll be checking on your back, the posterior side, for your vesicular and your brachiovesicular, and then on your lateral I'll be checking just for your vesicular, and then on your anterior I'll be checking for your bronchiovesicular, and your vesicular breathing sounds. And we'll get started. Okay, when I place my stethoscope, if you would just please take a deep breath. lateral. Okay, now onto the anterior. Okay, there are regular breathing patterns for the posterior. The ventricular is that the inhalation is greater than the exhalation, and for your bronchial vesicular, it is in equal inhalation and exhalation. And then for your lateral, the vesicular is greater inhalation than exhalation, and then for your anterior, the bronchial are less inhalation than there is exhalation, and then the bronchial vesicular is equal inhalation and exhalation, and then for your vesicular on your anterior it is greater inhalation than exhalation. And I did not note any wheezing, or I did not know any abnormal breathing sounds such as wheezing or rubbing, but if I did hear rubbing, I would differentiate between pulmonary and cardiac by having the patient hold their breath, and if the sound is still present, that would be cardiac. And that is all I have for you today. I'll put your bed rails up ×2, your bed in the lowest position. I have your call light and your personal belongings. Thank you so much for letting me be your nurse today and performing this exam. I'm just going to wash my hands on the way out.